Hello, I'm Dr. Katy Pack, and here in Ohio, medical marijuana is now legally available. But a lot of people still have questions about what steps they need to follow or what requirements they need to meet in order to obtain the medical marijuana. So today I'm going to review the requirements and steps you need to follow in order to obtain medical marijuana in the state of Ohio. So the first requirement is that the patient must reside in the state of Ohio. Second, the patient must meet with or establish a relationship with a healthcare provider that is certified to recommend medical marijuana. Now, it's important to note that not all healthcare providers in the state are able to recommend marijuana as treatment for their patients. The healthcare provider must do extra training and be certified by the Ohio Medical Board in order to recommend medical marijuana. Next, the patient must receive a diagnosis of a medical condition that qualifies him or her to receive medical marijuana. In the state of Ohio, the qualifying medical conditions are AIDS or HIV positive status, amyotrophic lateral sclerosis, which is also known as Lou Gehrig's disease, Alzheimer's disease, cancer, chronic traumatic encephalopathy, Crohn's disease, epilepsy or another seizure disorder, fibromyalgia, glaucoma, hepatitis C, inflammatory bowel disease, multiple sclerosis, pain that is either chronic and severe or intractable, Parkinson's disease, post-traumatic stress disorder, sickle cell anemia, spinal cord disease or injury, Tourette's syndrome, traumatic brain injury, or ulcerative colitis. So if a patient has one of these medical conditions, the next step would be that the patient must consent to being treated with medical marijuana. Now, children are able to be treated with medical marijuana in Ohio, and their parent or legal guardian would be the one to sign the consent forms. So once all of those requirements are met, the healthcare provider is the one who initiates the online process of applying for the medical marijuana card. Then the patient will receive an email prompting him or her to continue the application process and to submit the fee to the pharmacy board. The fee currently is $50, but if the patient is a veteran or indigent, then the fee is reduced to $25. Once all of these steps have been met, an Ohio medical marijuana card will be issued to the patient. The card is valid for 1 year from the date of issue, or if the patient is terminally ill, it will be good for 6 months. The patient will then take this card along with their driver's license or state ID to a dispensary. Now, a dispensary is basically medical marijuana store that has been licensed by the pharmacy board or given permission to sell marijuana products. The patient can purchase up to a 90-day supply, and there are certain dosage forms that are approved in the state of Ohio and others that are prohibited. Here in Ohio, the approved dosage forms are oils and tinctures, edibles, plant material, and patches. Now, the law specifically prohibits smoking or combusting the marijuana plant because it is known that when you burn marijuana, it releases toxins that are then inhaled and harmful to the respiratory tract. Also, any dosage form that would be attractive to children is prohibited in the state of Ohio. So hopefully this answers some of your basic questions about medical marijuana in Ohio, but if it doesn't, you can go to medicalmarijuana.ohio.gov. That's a website that is put together by the state of Ohio to help answer any of your questions. Thank you.